Welcome back to Everyday Iowa. Well, your smile is one of the first things people see when they meet you, and having a straight teeth and a nice smile isn't always a priority. Joining me is the owner of Mergen Orthodontics, Dr. John Mergen. Welcome.
Hi, thanks for having me on.
Yes, thanks for being here. All right, so today we want to talk about orthodontics with children and Invisalign we want to talk about here. But first, let's kind of start with kids. When should children first be evaluated for orthodontics?
Yeah, it's really important as far as age-wise, as far as being able to do preventive treatment. So we not only straighten teeth, but also help with facial growth and development. And so helping to expand arches to help make space for teeth, but that also helps with airway issues too. So we see a lot of kids with sleep apnea issues. And so when we can expand arches, that helps make space for the tongue, that helps to make it easier to breathe for kids. It also helps with airway development also. And so if we can see kids around 6, 7, that's when permanent teeth are just starting to come in.
Oh, okay, that's young.
So yes, so between ages 7 and 9 is when we can actually influence this facial growth, where if we don't see these kids till, say, age 12, like we've missed out on all that growth potential. So as orthodontists, we don't only just align teeth, but we also help with facial growth and development, which is very important. But if we don't see the child at that early age, we can't help influence that. So,
because I know, like when I had braces a long time ago, you didn't really get seen until you had your adult teeth in. So that is absolutely not the case anymore.
No.
You're treating much younger now. And there's a lot of benefits, like you said, to being treated younger.
So if we can help promote growth and development and help make space for permanent teeth, then we can help prevent major problems from ever happening later in the future, such as like impacted teeth, if somebody has severe crowding issues and we have to extract teeth. Or jaw surgery even. And so if we can prevent those problems, that's my main goal, especially with kids, is trying to prevent major problems so that kids don't have to experience all that and they can have a much better end result also.
Okay, so you are a top 1% Invisalign provider, which, oh man, I wish that was around. I wish that was around when I was younger.
I do too.
Yeah, right? So can you tell us, are Invisalign, are all providers the same, the results the same with Invisalign?
They're not. So everyone has a misconception that Invisalign is Invisalign, doesn't matter where you get it, from a dentist, orthodontist, and that's actually not true. And so Invisalign, it's a tool, just like braces are a tool. And so as an orthodontist, I actually go into the software program and custom treatment plan every single case to create trays to do what I want to do with the Invisalign trays. So you're going to get a much different result from different providers. So if somebody doesn't have experience on how to use Invisalign, they're not going to be able to get as good a result. And so I've been an orthodontist for 27 years. I've been using Invisalign for over 15 years.
Oh, wow.
And we pretty much just use mainly all Invisalign now. So.
Well, what if somebody's told that they're not a candidate for Invisalign? Are there other options?
Absolutely. So most of the time when patients are told they're not a candidate for Invisalign, it's usually because an orthodontist either doesn't really use Invisalign or they don't feel comfortable doing that treatment with Invisalign. So a lot of it has to do with experience with the doctor. And so 99% of those patients, yes, like we can do Invisalign. So I have patients come in all the time, second, third opinion, they were told they were not a candidate for Invisalign, and they absolutely are a candidate for Invisalign.
Are there a few cases when somebody wouldn't be, like, because they have...
There's always examples of that. One would be like impacted cuspids, where teeth are up in the bone and we have to have the oral surgeon go in and we have to pull them down. That would be a case where I use braces, but that's about the only type of case that we don't do Invisalign with. So.
But if somebody has braces on for that, can they switch to Invisalign ever? Or is it, so you can,
absolutely.
Really?
Yes.
Oh, wow.
Yeah, so we've had patients, same thing, where we're finishing up treatment for them and we actually take the braces off and finish up with Invisalign just because they've had enough of the braces. I had braces as a kid. I personally did not love braces.
No, I did not either.
I don't have too many. I
complained every day, I think.
I don't have too many patients that come in and ask for braces. But
that would, amazing that you can start with braces because you need to, you're the 1% who needs to, but then you can switch.
Sure, absolutely.
That's great.
Absolutely.
Okay. So where can people find you and get more information?
Sure. We have a practice in Iowa City and then also in Coraville. And so obviously you can go online. That's probably the easiest way to find us. MergenOrthodontics.com.
And how far out? Do you need to book an appointment? Do you have to go through your dentist, your primary dentist?
And that's another thing also. People always wonder if they need to be referred by the general dentist, and you absolutely do not need to be referred by your general dentist. So general dentists, they have an idea of when they see big problems or major problems. Like, yes, there's a lot of crowding issues. We need to get you an orthodontist. but there's a lot of underlying issues, especially with kids that are younger, where if they're not having proper growth and development with their jaw bones, or they're asymmetrical, or maybe they have sleep apnea issues, that as dentists, we weren't trained on that, so they don't really know. And so if you get in at age 7 and have evaluation with the orthodontist like ourselves, then we can help inform parents so that they know what's going on. If nothing's going on and we need to wait till they're a little older and have more permanent teeth in, no big deal, but at least parents know and have that confidence of knowing what's going on.
Thank you so much for being here today. I really appreciate it.
Thank you so much.
Thank you.